Good afternoon, everyone. If you're just tuning on to Facebook, I'm joining you from my living room. We are talking today. We're in the middle of a pandemic and people have a lot of questions. So today we're joined by Dr. Scott Walker from Starling Physicians. Dr. Walker, thank you so much for joining me today on Facebook.
No problem. Thanks for having us.
So we're in the middle of a pandemic. We're kind of in this phase 2 situation. The cases are going, they're on the rise. It's going to be really tough for families and for people battling this. What are some of the symptoms if you're at home and you're not sure? What should people be looking out for?
Yeah, so I mean, the initial symptoms a lot of times are high fever, cough, chills, muscle aches. But we have seen some people who develop some abdominal pain, diarrhea, um, congestion. So some people have reported kind of this sinus congestion. The biggest one is also loss of taste and smell. That one's pretty unique versus the common cold or the flu. The flu and coronavirus can be a little difficult to tell the difference. So if you're unsure, I would certainly encourage people to call their doctors and, we can help go from there. And certainly testing is key.
If you're just joining us, I know a lot of people are just tuning in. We're speaking with Dr. Scott Walker from Starling Physicians, and we're talking about the pandemic and COVID and what some of the symptoms are. You just mentioned a lot of the symptoms overlap with the flu or even a head cold. When should people start to be concerned? Maybe I need to get tested.
So testing, definitely if you have a high fever, cough, shortness of breath, if you have any exposures that you know of, those would all be times where you would definitely want to go and get tested. One, to see if you have coronavirus, and certainly you should quarantine until you know your results, and also beforehand. So if you go get tested, please don't go out to buy groceries or anything after you get tested. Assume that you're positive until you know whether or not the test is positive or negative. And two, the other important part of testing there is just because you're having a cough, it doesn't mean that it is coronavirus. So the other importance is there's lots of other reasons you could be having cough or shortness of breath or fever. So what we like to do is early on try to see whether or not you potentially have coronavirus. And if you don't, obviously we want to work those up further. And if you do, then obviously we want to keep you at home, quarantine, and monitor the symptoms.
If you're just logging on, we have a lot of people logging on. We're talking with Dr. Scott Walker from Starling Physicians. We're talking about COVID. If you have questions for Dr. Walker, I'm watching the feed right now, so be sure to ask them, and I will get those questions to him. Now, there's a few different types of tests that you can get. What are the differences between them, and should people look to do a certain one over another?
Yeah, so the different tests that are out there is, so there's the rapid antigen test. That's the one that people commonly refer to as the rapid test. The benefits of that one is, you get the results relatively quickly, 15 to 20 minutes, which is certainly beneficial. The downside to that one is it's not nearly as accurate as the PCR version. The PCR version was the initial test that we're using. It's a nucleic acid test. It is much more accurate than the rapid test. So, our preference is really PCR tests. The reason being is, their accuracy is much, much better. Sometimes there's not much of a choice. And, we'll use the rapid. But really the rapid I would think of more as you're asymptomatic. You had kind of maybe a small exposure and you want to just go and get a quick answer, a rapid is fine for that. If you have symptoms or a true exposure that you know of, I would encourage everybody to get the PCR test because it's much more correct.
So definitely some different options. Now, a little bit of a personal note, I am home because I had a close contact. So I'm quarantined thanks to modern technology. I'm still able to talk to you from my living room. I think a lot of people, I went and got tested and I'm quarantining at home until I get my test results back. I heard 3 to 5 days, maybe sometimes longer. What are you hearing as far as how long these test results are taking to come back?
So the test actually itself can come back pretty quickly. So they can run the test in a few hours. So the reason for the variation is volume going to the labs. And they do try to, delegate it into the tests that are coming from the hospital, the tests that are coming from different offices versus kind of the low-level tests of, I'm asymptomatic and maybe I had an exposure. So the reason that you see this, shifting as far as how long tests come back is more of the lab trying to delegate which tests are critical that they get done quickly and which tests can wait a little bit. So it's true. It can be anywhere from, you can get the results as quickly as a day sometimes. And, if there's heavy volume like there is right now, it can take up to a week to really come back. But I would say
So
most of
my
the
next
time
question is
it's
going
in
to
that
be
2
about
to 4
when
days.
I'm sorry, go ahead.
Most of the time it's in that 2 to 4 day range. That's kind of what the labs are trying to target a 2-day turnaround, but obviously with the increased usage, it's difficult to get that turned through.
My next question, doctor, going to be about when you should call a doctor or go to the hospital. And we actually have a question from one of our Facebook viewers right now. Lauren wants to know if you're checking your oxygen saturation, at what point should you be concerned and maybe go to the emergency room?
Sure. So if you're looking at the emergency room, it's really 91% or less. The other thing to always realize with the oxygen saturation monitors is it's a light that's going through that's trying to measure the oxygen pulse ox. So you want to make sure you don't have any dark nail polish on to try to get the accurate results, and make sure that the hands are warm. So that way you get accurate results with that. And if you're feeling okay, but your oxygen's dipping, I would definitely encourage you to talk to your doctor. But certainly if your oxygen sats, you've checked those things, it appears to be accurate and you're saturating, 91% or less, going to get checked out makes a lot of sense. If you're going to go get checked out, though, make sure that you're calling the hospital ahead of time. They need to know that you're going to be coming in and that you think you have coronavirus or that you are tested positive for coronavirus. And you just have to listen to their procedures as to how they want you to come into the emergency room and be seen and evaluated, because it will be different. You can't just drive up and walk in, obviously.
Now, if you're just logging on, we're talking to Dr. Scott Walker from Starling Physicians. He's answering your questions. If you have them, definitely type them below, and we'll do our best to answer them. Dr. Walker, what are some
100.4 or higher? I wouldn't necessarily go to the hospital for a fever. I would call the physician for that. If you're feeling short of breath, if it's mild, I would say you could call your doctor and discuss the next steps. If it's, more in the moderate range where you're out of breath, just, talking to someone in a conversational setting, then that I wouldn't even wait. I would certainly, again, go to the hospital. But again, in going to the hospital, you definitely want to call them ahead. And when in doubt, if it doesn't seem that it's inundate the hospitals.
Another one of our viewers, Linda, she wants to know how long you have to quarantine yourself if you have COVID.
So if you're testing positive for COVID, the CDC has changed. It used to be 14 days. The new recommendation is 10 days from your positive test, provided that you have no fever at the end without using any Tylenol and that your symptoms are improved. You can also do a 7-day quarantine provided that you have a negative test after day 5. So that one's going to be harder to do because it should be a PCR test. But the CDC did say it is possible to do a 7-day quarantine. And that again also assumes that you're feeling better, symptoms are basically gone, you're not having any fever, you're not using Tylenol. So I would say for the most part, it's a 10-day quarantine.
We have a comment that I'll just read you from Irma. She says, "Thank you, Dr. Walker, and to your staff. I must say, throughout COVID, Dr. Walker and his staff have done a phenomenal job helping their patients. Again, thank you and your staff and Starling." So that's just a nice comment I thought you should hear. We're talking to Dr. Walker from Starling Physicians. If you have questions, definitely, ask him. I'm monitoring the feed right now. Audrey wants to know, can a person get COVID a second time? Are you immune for a period of time?
It appears you're immune for 3 months at least. We've heard of some people getting a second, but it's pretty rare so far. So as far as we know, you do get an immunity. It's unclear how long the immunity lasts.
Joe wants to know, and I think we all want to know, and if we had a crystal ball, maybe we could answer him. He wants to know when life will go back to normal.
Hopefully soon, so you have the vaccines that are coming out, and Pfizer's is already getting distributed, and it looks like Moderna will probably start getting distributed probably soon, probably next week. The hard part is really production of these vaccines and getting them to everybody who wants them. Unfortunately, that's probably going to take a while, as far as, the phase 1 distribution, which is really healthcare and the nursing homes. It looks like that'll take them at least 10 weeks. And then we will continue to kind of slowly roll it out in phases. So my guess would be we're hoping that everybody who wants to be vaccinated will be able to be vaccinated by, summertime. So, at that point, the hope is that things would start to return to normal. I know everybody wants to know, when can we take off these face masks? I think for now the answer is we just don't know. And once I get vaccinated, can you take off the face mask? And the answer for now is no, you can't. So we'll see. Stay tuned. I'm sure all of us are itching to get back to normal and traveling and seeing everybody and being able to get rid of the masks and feel comfortable again. But the good news is that we're getting closer. So this just hang in there.
Now, where can you go if you want to get tested? I know Starling has a facility where you can go.
Yeah, so right now there's testing sites. There's CVS. So if you go on Minute Clinic, they have both rapid testing, PCR testing. The urgent cares mostly have rapid testing. And the hospitals have PCR testing. The hospitals usually require an appointment, and some require a doctor's order. Most of the other ones do not require a physician's order. Starling is setting up its own station that will be performing coronavirus testing. We're using Roche's unique PCR test, which will give us answers quickly. So it'll essentially feel like a rapid test, but it'll be done in a matter of minutes versus days. That is going to be somewhat limited. The only reason we're limiting it is because we don't have tons of supplies. So I would encourage people to call their doctors, and if we feel like it makes sense for you to go and get the swab performed at Starling, we will definitely get that set up. But that lab, just let everybody know, it's not up and running just yet. It's coming. We're still working on reagents. So
I have one more question for you, Dr. Walker. Lori wants to know, is fatigue, runny nose, and nausea a sign of COVID without a fever?
It can be. So we're seeing a ton of fatigue with coronavirus, and I found it tends to last for a while. Some people it's been up to 2 or 3 months. They also continue to kind of feel easily winded. And we've definitely seen people where fatigue and nausea were symptoms. So again, if you're having those symptoms, I'd encourage you to go and get tested and make sure.
We've been talking to Dr. Scott Walker from Starling Physicians. He's been answering your questions about COVID and giving us some advice. Dr. Walker, thank you so much for joining us today on Facebook.
No problem. Have a good day.
You too. And if anyone out there wants to get more information, you can visit starlingphysicians.com.